بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. Today I will present 3 cases can be spot diagnosis and in pediatric age group. The first case, as you see here, in this newborn, multiple lucencies involving the left hemothorax, causing shifting of the mediastinal structure of the heart and the trachea to the right side, and also the esophagus. And the diaphragm is not well seen in this case. And this is a classic case of congenital diaphragmatic hernia, and it is usually more to the left side, and the prognosis is depend on the lung development. Children with larger hernias and hernia containing liver have worse prognosis. The next case is a newborn presented with respiratory distress as the same one, but different cause of respiratory distress. As we see here, there is lucency involving the left upper lobe compared to the rest of the lungs. And the list of differential diagnoses, it is include congenital lobar emphysema or congenital lobar overinflation in the new terminology, and bronchial atresia, one of the differential diagnoses, and also CBAM. Here, as we see, the common site for congenital lobar overinflation and previously called congenital lobar emphysema. So this is a classic example of congenital lobar overinflation, previously called congenital lobar emphysema. Here is another patient with respiratory distress in neonate, and as we see here in the right lung, a multi-septated cystic mass in the right hemothorax involving the mid and lower zone, and this is cystic pulmonary airway malformation. And we have 3 types, and this is type 2, characterized by numerous small to medium-sized cysts. And this is the same child with CT scan, and we see multiple cysts in the right mid lower zone. As I said, the differential diagnosis also include pulmonary sequestration and congenital diaphragmatic hernia, but the diaphragm it is but not shown in other Slices not shown in the other slices. It is intact, and there is no apparent blood vessels going to the sequestration. So this is classic example of congenital cystic adenomatoid malformation, or cystic or congenital pulmonary airway malformation, CBAM. This is the new terminology. Thank you for listening and hoping to see you soon in another talk.